When you picture glamour, you see that celebrity with a cigarette in her hand, right? Now that's the before picture. What about the after? The American Heart Association Surgeon General states that the leading preventable cause of disease and death in the United States is cigarette smoking. Cigarette smoking reduces the risk of coronary heart disease all by itself. When combined with other factors, the list goes on and on. The key here is that it's preventable. If a smoker discontinues use, approximately 15 years later, their body would return to nearly the state previous to smoking. Smoking cigarettes can affect others around you, not just yourself. Secondhand smoke increases the risk of coronary heart disease in adults by approximately 30%. This effect is larger than one would expect on the basis of the risks associated with active smoking and the relative doses of tobacco smoke delivered to smokers and non-smokers, as recorded in the 2005 article by the American Heart Association titled Cardiovascular Risks of Secondhand Smoke. Therefore, the effects of secondhand smoke are substantial and rapid. All smokers, and ones exposed to secondhand smoke, have higher lead concentration in their blood. In a study of children ages 4 to 16, according to epidemiology in November of 2003, they found that children who had previously been exposed to secondhand smoke had elevated lead levels in their blood. They came to the conclusion that in this age group, elevated blood levels are probably associated with secondhand smoke. Like the cigarettes can affect others, they can most definitely affect you as the smoker. There are many effects which can harm the smoker. Memory performance can be altered. In a recent study performed in 2002, 20 non-smokers and 20 smokers went through studies testing for effects in memory. As stated in the article, Acute Effects of Cigarettes in Non-Deprived Smokers on Memory, they found that there was a little negative impact on memory in smokers. In a study of men and women varying from ages 20 to 65 years in age, as published in the 2008 article titled Long-Term Exposure to Traffic-Related Air Pollution and Lung Cancer Risk, they found that subjects who had smoked for 3 years or more were at an increased risk for bronchial asthma and lung cancer. Lung cancer is increasing more rapidly and causing more deaths than any other form of cancer in the adult male population. Many investigators sense that cigarette smoking has a huge effect, as stated in the Journal of the American Medical Association. In women, pregnancy issues can evolve. If all women quit smoking during pregnancy, around 5% of newborn deaths could be prevented, as stated in the Illinois Department of Public Health in a recent article of Health Week. They also stated that women who stop smoking before becoming pregnant or during the first trimester of pregnancy reduce the risk of having a low birth weight baby to that of a woman who has never smoked. Along with birth defects, it takes female smokers longer to get pregnant than non-smokers. Women who quit smoking before trying to get pregnant are as likely to get pregnant as a woman who has never smoked. Women also can possibly increase their risk of breast cancer by smoking. In a 2002 publication of the International Journal of Cancer, they state some recent findings to support this idea. Looking at women aging 40 to 59 years at the time of recruiting, all had up to 30 years of continuous smoking duration. Over an average of 10 years of follow-up appointments, they came to the conclusion that smoking of a very long duration and at a high intensity is possibly associated with an increased risk of breast cancer. So now, hopefully you're all thinking, where should I start? The Journal of the American Medical Association states that 90% of successful quitters say they quit on their own without any assistance. Many of these individuals use the method of quitting cold turkey. This is simply just not smoking another cigarette. They also state that among smokers who quit within the past 10 years, 47% who tried to quit on their own were successful, whereas only 23% of individuals who had assistance through a program were successful. Here locally, we offer a smoking cessation program through St. Clair Regional Medical Center. If you try to quit on your own and are unsuccessful, don't give up. The Illinois Department of Public Health also states that 70% of ex-smokers had to make 1 or 2 attempts before succeeding. So try again.